Okay, Cancer Research Project. Okay, so our background information. So we picked Hodgkin's lymphoma, and we picked Hodgkin's lymphoma because my grandpa had this cancer a few years ago, and I could see how the treatment and the cancer affected his day-to-day life. So, what happens to the affected cells in Hodgkin's lymphoma? Hodgkin's lymphoma happens when your B cells mutate. B cells are white blood cells that help fight infection. When these cells mutate, they create cancerous cells called Reed-Sternberg cells. These Reed-Sternberg cells are larger than normal cells, multiply faster, and live longer than normal cells. These Reed-Sternberg cells also create cytokines that are substances that attract normal cells to lymph nodes carrying the abnormal cells. The normal cells get caught up in the action and they release substances that make the Reed-Sternberg cells grow. The result is swollen lymph nodes that expand to accommodate the growth. So Hodgkin's lymphoma most commonly affects the lymph nodes in the neck, underarms, abdomen, and pelvis. And some of the symptoms for Hodgkin's lymphoma are painless and swollen lymph nodes, fever, and night sweats.
Process and test. So the patient will be asked about their symptoms, their possible risk factors, their family history, and other medical conditions. Next, the doctor will examine the patient and they will look at the any affected areas, especially like the swollen, if they have swollen lymph nodes. If the doctor suspects that HL might be the problem, then a biopsy will be recommended, but they will wait a couple weeks to see if it shrinks, if the swollen lymph nodes were just because of an infection. If they don't shrink or if they continue to grow, a lymph node or a small piece of the node will be taken out, surgically removed, and they'll checked out by a pathologist, which is a doctor specially trained to see cancer cells, to recognize cancer cells. They'll look for Reed-Sternberg cells, which confirm a diagnosis of HL. Your test results are then used to assign a stage of your Hodgkin's lymphoma. The stage helps determine the seriousness and the treatment that was needed. The stage is 1 through 4. If it's a lower stage, then it means that the lymphoma cells only have one or a few areas of lymph nodes, and an early stage cancer is easier to be cured, and a higher number means that it's more advanced. Hodgkin lymphoma stages also may include the letters A, B, E, and S, and if it's in the B stage, you may need more aggressive treatment. Imaging. So imaging tests are also done. Imaging tests can be used to look at possible causes of certain symptoms. They can determine the stage, see what treatment you need, and see if cancer comes back. One example is a chest x-ray. HL often enlarges lymph nodes in a chest, and this can be seen on a chest x-ray. It can also see if the cancer is spread to the chest or the lungs. Another scan is a computed tomography scan, which is a CT scan. And on the left, that's a machine of a CT. On the right, that is a picture of one of the scans. So the scan takes a series of x-rays that build up a 3D picture of the inside of the body to check the spread of the cancer. And this can help tell if the lymph nodes or any organs in your body are enlarged. And for the scan, it has colors gray, black, white that can represent air or bones. And if any of these have abnormalities, that's how you can kind of read the scan. Next is possible causes. So Hodgkin lymphoma is caused by mutation in the DNA of a type of white blood cell called B lymphocytes. And the DNA gives the cells a basic set of instructions like on the left, but then the mutation in the DNA changes these instructions so the cell keeps growing, causing it to grow uncontrollably and multiply. Researchers believe that the cause may be connected to the Epstein-Barr virus, which is EBV. EBV, you can get it when you're a teenager, which can lead to mono, and it makes it 3 times more likely for you to get Hodgkin's lymphoma. Your risk for HL is also increased if a first-degree family member or relative has had it, like your parent, sibling, or child. And they're not exactly sure why this is, but it may be because of an inherited genetic fault or lifestyle factors.
Okay, so chemotherapy. Chemotherapy treats cancer with strong medicines, and there's many different types of chemotherapy, but usually for patients with Hodgkin's lymphoma, they receive combination therapy, which is a combination of chemotherapy with other treatments like targeted therapies and radiation. So the most common combination of chemotherapy used to treat HL is ABVD. ABVD includes doxorubicin, bleomycin, vinblastine, and dacarbazine, and the side effect of chemotherapy depends on the medicines that you're given. Common side effects are nausea and hair loss, but there's also serious long-term complications that can occur, such as heart disease, lung damage, fertility problems, and other cancers. After chemotherapy, doctors use a PET scan or a CAT scan to see if all the cancer has disappeared, and if it hasn't, radiation therapy may be given. Radiation therapy. Radiation therapy treats cancer with powerful energy beams. The energy can come from X-rays, protons, and other sources. The radiation is directed to precise points on your body. For Hodgkin's lymphoma, radiation can be aimed at affected lymph nodes and the nearby areas where the disease might spread. It is usually used with chemotherapy. Radiation therapy side effects include fatigue and a sunburn-like reaction on the skin where the radiation is aimed. Bone marrow transplant. The bone marrow transplant involves putting healthy bone marrow stem cells into the body. These cells replace cells hurt by chemotherapy and other treatments. It's usually an option if the cancer comes back. During a bone marrow transplant, your own blood stem cells are removed, frozen, and stored. Next, you receive high-dose chemotherapy and radiation therapy to destroy cancer cells in your body. This usually also destroys some of the healthy cells. So then the stored stem cells are thawed and put back into your body to help build healthy bone marrow. Targeted therapy. Targeted therapy for cancer is a treatment that uses medicines that attack specific chemicals in cancer cells. By blocking these chemicals, targeted therapy can cause cancer cells to die. Monoclonal antibodies are the most common type of targeted drug that is used for Hodgkin lymphoma. Rituximab and rituximab are a type of monoclonal antibody that are used for HL. They target specific proteins on the lymphoma cells and help the immune system to find these cells and kill them. Rituximab targets a protein called CD30, which is found on Hodgkin's lymphoma cells. Rituximab sticks to the CD30 and delivers a drug that kills the cell. Rituximab targets a protein called CD20, which is found on white blood cells, called B cells. This then flags the cells to the immune system, which then picks up the cells and kills them. Prevention. So most cases cannot be prevented because we do not know the cause of most Hodgkin disease cases. But keeping in good health helps. By following the health pyramid, you can keep a good diet, a good and balanced diet, which helps because having less body fat decreases the chance of getting most cancers. And also constant exercise will help with this. And new developments right now are that scientists are working on vaccines against Epstein-Barr virus related diseases, which will help prevent Hodgkin's lymphoma.
Demographics. So HL can develop at any age, but it typically hits the young and the old. And under 5-year-olds, it's very rare for them to get it, but it's the most common when you're in your 20s. That it can come back when you're after you're 55. In addition, having a medical condition or a treatment that weakens your immune system can make you more likely to get HL, because if you have a lowered immune system, you're less able to fight infections that increase your chance of developing HL. So one example of that is human immunodeficiency virus, which is HIV. HIV infects the helper T cell, and without them, your immune system can't work properly and you're less able to fight infections. Next, approximately 0.2% of men and women will be diagnosed with Hodgkin's lymphoma at least once in their life. And about 8,500 to 9,000 people in the US are diagnosed with Hodgkin's lymphoma each year, which is around 0.4% of all new cancer cases. And it affects slightly more males than females. Current researchers are now testing the randomized phase 3 study, which compares a standard treatment with chemotherapy and brentuximab vedotin against the immunotherapy nivolumab plus chemotherapy. There are nearly 1,000 patients in this trial, and half of them do the standard therapy, which is chemotherapy and a drug called brentuximab vedotin, and the other half receive the chemotherapy plus an immunotherapy nivolumab. After 2 years of follow-up, 92% of the people in the immunotherapy group had not only survived, but saw no progression of the disease, compared to the 83% in the standard care group. Thank you.
Thank you.
Oh, and these are our citations.